Canadian smoke has been hanging in the air since Tuesday afternoon. And
while we can all see it and smell it, we wanted to know more about how it might impact our breathing, our lungs, and our overall health. Our Lisa Adams invited in a UPMC pulmonologist to talk about the health impact of breathing in this smoke. They are joining us now live from the alert desk tonight. Lisa.
Good evening, guys. My guest is Dr. Mario Kinsella. He's a specialist in pulmonology at UPMC Hammett, so we can all see it. We know we're in the red zone. We can smell it. But I guess we wanted to know a little bit more about these particulates that are in the air and what it does to the average person who doesn't have any respiratory problems when they breathe this in. John Salins was saying he was feeling it in his sinuses. Sure. We're all coughing a little bit too, even if we don't have problems.
Yes, Lisa, I think what's happening is, thank you for having me in, by the way, we are breathing in, and with smoke, the major concern are these tiny, tiny little particles, about a 50th of the width of a human hair. They're really tiny. We breathe them in, they can cause irritation in our airways and in our lungs. For normal people, that should not be a factor. If you have underlying lung disease or heart disease, they can be a problem.
Yeah, explain why it is a lot more serious if somebody does have COPD, like the person that Ethan interviewed today, or heart disease, or asthma. I mean, they already don't have those natural defenses, right?
They don't have the natural defenses as good as people who don't have those diseases, but if you have airway disease, for example, like COPD, or asthma, where you may have inflammation in your airway already, you've narrowing of your airways already, you're producing excess mucus already. By taking in these tiny particles which can cause irritation in your airway, you make your underlying problem worse.
And you may really not be able to catch your breath.
You may not be able to catch your breath. Patients with asthma and COPD are particularly at risk of developing what are called exacerbations of their underlying disease, and really need to try and avoid breathing in these tiny, dangerous particles.
All right, so as you've been hearing, we know we need to limit our outdoor time and activities. The doctor is going to be in with us at 5:30 and 6. We'll be right back.